In October 2020, the National Core Studies commenced as part of the UK's response to the COVID-19 pandemic. The National Core Studies are using health data to rapidly inform policy. The aim of the Longitudinal Health and Wellbeing National Core Study is to understand the health, social and economic impacts of the pandemic. The team are doing this by uniting UK-wide longitudinal population cohorts with electronic health record databases. This large multi-institutional team are working together to answer policy-relevant questions across several different areas. These include mental health, society and health, healthcare disruption, vaccination, serology and long COVID. The team prioritise questions that harness the unique aspects of the resource, such as pre-pandemic data. By working together and triangulating analyses in longitudinal population cohorts and electronic health records, we can provide robust evidence to inform policy. Current priority research questions include: how was healthcare disrupted during lockdown? Did government schemes such as furlough help? How was mental health impacted by the pandemic? Are the vaccines safe and how well do they work? What are the short and long-term consequences of infection on physical health, including long COVID? Here are some examples of key impact work to date. During lockdown, the team identified inappropriate switching of blood thinners from warfarin to direct oral anticoagulants, and this triggered a national alert to GPs. Policymakers have been provided with information on long COVID burden of disease, risk factors, definition and long-term outcomes via cabinet briefing reports and SAGE reports. NICE used the long COVID findings in its evidence review for risk factors. The analysis played an important role in the evidence assessment. To improve the use of long COVID GP coding, the team have engaged with primary care software suppliers and created a dashboard to inform evidence generation and planning of long COVID services. Briefing notes have been submitted addressing inequalities in healthcare disruption, mental health decline during lockdown, the impact of furlough on behaviour and mental health, and reasons for low antibody response after vaccination. Early quantification of vaccine side effects informed the Chief Medical Officer. Our work has identified that people with learning disabilities should receive early vaccination, and we also reported ethnic differences in vaccine uptake. The unified approach to new data collection and analyses is a major advantage to this collaboration. However, this way of working generates both advantages and challenges. The team have had to overcome various administrative, staffing, and contractual challenges. Data-related challenges include finding ways to handle heterogeneity of historical data and dealing with poorly measured key COVID-19 outcomes. Despite the challenges, the outputs and impact that the study has had to date shows the value of uniting resources to answer a broad range of COVID-19 policy-relevant questions. This work also highlights how the diversity and domain expertise embedded within the UK-wide longitudinal population studies can be mobilised and leveraged during times of crisis.